Hello, my name is Chad Kaysen with Lifelong Insurance, and this is my website, lifelonginsurance.com, where you can find out a little bit more about me and what I do. But basically, I specialize in helping people all across the country figure out their Medicare supplemental coverage options, which company, which plan is best for them, and that sort of thing. So this is my website if you'd like to learn a little bit more about me. And also towards the bottom here, you can schedule a phone call with me if you would like. Okay, so just real quick, I just wanted to go through in this video, primarily just going to talk about Medicare Supplement plans, also known as Medigap. This is also my contact information here. And so real quick, Medicare Supplement plans, also known as Medigap, they're basically going to come in and pay what original Medicare Part A and Part B does not pay, right? So you've got Medicare Part A as your hospital, Medicare Part B as your medical, and that's going to provide you 80% coverage. Okay, so a Medicare Supplement plan is going to come in and pay the Medicare Part A hospital deductible for you, as well as the other 20% coinsurance, in addition to the 20% coinsurance under Medicare Part B. Okay, so your Part A is all your inpatient hospital, skilled nursing, that sort of thing. Your Part B is pretty much everything else: primary care, specialist, outpatient, physical therapy, chiropractor, all of that kind of stuff would be under Part B. So if you buy a Medicare Supplement Medigap plan, it's going to be coming in and basically paying all of that 20%, as well as the Medicare Part A deductible. So the most that you might have out of pocket if you have a Medicare Supplement plan with your A and B for the calendar year is basically just going to be whatever the Part B as in boy deductible is. Okay. And maybe a small copay. And we'll talk about that. But again, copays, coinsurance, deductibles. And so Medicare will pay its share of the Medicare approved amount, and then your Medigap policy will pay its share. All right. And so a couple important facts here: you must have Medicare Part A and Part B. You're going to pay a monthly premium for your Medigap policy in addition to the Part B premium. Okay. Medicare supplement plans will not have drug coverage included. However, you will, any type of drugs that are administered in a hospital or a doctor setting will be covered under Part A and Part B and your supplement. But as far as your maintenance, routine drugs, statins, blood pressure, diabetes, heart meds, all that kind of stuff is going to be covered under a Part D drug plan. Okay. The costs can vary by company, even for the same plan. And the policy can go up a little bit each year as you get older, in addition to inflation and other factors. The best time to buy a Medicare supplement plan is when you basically are 65 and older, and your Medicare Part B is starting for the very first time. Even if you delayed Part B, maybe you had coverage through an employer or a spouse's employer, they were working, that sort of thing, or you were working. Even if you've delayed it and you're older than 65, it's basically that 6-month period is triggered when your Part B starts for the very first time. Okay. And so you cannot be declined due to your health. Okay. There's no health questions asked during that time. Okay. So that's the best time to buy a Medicare supplement plan. You can keep your doctors. Okay. I mean, basically there's no networks when you have original Medicare Part A and Part B and a Medicare supplement plan. You can go to any doctor or hospital that accepts Medicare. All right. And the Medicare supplement plans are standardized. And basically what that means is that whatever plan that you are looking at or comparing, for example, the plan G is in George, when you're looking at that plan with every single company that sells it, the benefits of that plan and how that plan pays with Medicare is going to be the same across the board. The only differences are going to be the rates. So the idea is to find or go with look at the plan that we want and go with a reputable company that's got a proven track record, but that has the lowest rate, right? So the lowest rate for the plan that we want, but with a reputable company. Okay. And so that's what we're going to look at here in this particular situation. All right. And this just kind of gives you a chart of what the Medicare supplement plans that are available are. Out of these 10 in my 11 years of doing this at the making of this video, the plan G is in George, the plan N is in Nancy. Those would be the two that I recommend, at least in all of the states that I'm licensed in. These two plans seem to hold the most value. And as far as what the insurance companies price these plans out versus and what you get for your money versus how they may price out the plan A or these other plans that you see here on this list. And so this chart really kind of shows you, how these plans work, and you can compare them side by side. Okay. And again, so once we decide on the Medicare supplement plan that we want, pretty easy to compare. Plan G in this example, you've got 5 different companies. I mean, this is just an example here, but it's comparing apples to apples, okay? I mean, really, we know that the plan is going to pay out the same. So as long as Medicare approves your service or procedure, which is basically anything that's medically necessary, then Medicare is going to approve it, and your Medicare supplement plan will pay accordingly, okay? So let's take a look at the rates in your particular state. And from there, if you want to set up a call and get your particular or zero down on your zip code and your county and everything, we can definitely do that as well. All right. So just to let you know, again, there you go. My name is Chad Kaysen, and 404-996-0045. That's the best way to schedule an appointment with me. And we can really, get your questions addressed, get your questions answered, and find the right Medicare plan for you.